35-year-old female presented to the OPD physical examination findings are given in the image. Which structure is affected in this condition? Okay, so you can see here the PD orange image, and in the PD orange image there is only the involvement of the subdermal lymphatics. So there is here the answer will be the involvement of the subdermal lymphatics. So next slide. The young male presented with the slow growing midline swelling in the interior part of the neck. After 6 months, bilateral cervical lymphadenopathy developed. Histopathology slide is given below. All of the following are correct about this condition except. So this is the slide showing the papillary carcinoma, which is the oval NEI nuclei, and in this lymphatic spread is seen, so it is correct. Then specific nuclear pattern of histology, it is also correct. Has excellent postolosis is also correct, and the FSC is not the diagnosis, it is not correct, so the answer will be D. Third question, the patient underwent the endoscopy which showed the multiple yellow-white plaques in the bladder. The histopathological examination showed the infiltrated lamina propria layer as shown below. So what is the diagnosis here? So here you can see the Michaelis stamen bodies, which is seen in the melanoplakia, and here also in the question you can see yellow plaques are seen in the bladder, which is also seen in the melanchoplakia. So the answer will be the melanchoplakia. Interstitial cystitis can't be the answer. Acute cystitis, chronic cystitis, which showed pus cells in the slide, so it's also the not answer. Then route of metastasis of prostate cancer to lumbar vertebra. So here you can see the interiliac vein and the its plexus. Here you can see the plexus here, right? These are the plexus, and which is supplying the whole part of vertebra, lumbar vertebra, which is going through lumbar vertebra through interiliac vein, which is called Bartson plexus, and it is transmitted through the prostatic venous plexus. Okay, so the answer will be prostatic venous plexus. Next question, a 30-year-old patient with motor vehicle accident presented to the casualty. His vitals are stable, but he is unable to pass urine. He has blood in the tip of meatus, and RGO was performed and as shown below. What is the most likely site of urethral injury? So here in the slide you can see the so the on the RTA fracture, there is most common site of injury is pelvic fracture. In the pelvic fracture you can see the urinary retention, then pelvic membrane, pelvic hematoma is seen, and bleed in the meatus is seen. And the most common site of injury is here you can see the membranous urethra is the most common site of injury, so the answer here will be membranous urethra. Okay, and next slide, a 55-year patient presented to the emergency with the scrotal swelling, ecchymosis, fever, and the serous discharge. Image is given below. What is the most probable diagnosis? Here in the diagram you can see that there is a gangrene is seen. Gangrene type of necrosis is seen in the scrotal area, and the gangrene type of scrotal area usually seen in corneal gangrene. In epidermolysis there is swelling in the testis, the torsion testis, also the swelling in the around the testis, and then the carcinoma testis there is swelling in the testis, not in the scrotum part of so here the gangrene may be seen in the corneous gangrene, so the answer will be corneal gangrene. In the next question, a 30-year-old male was being investigated for infertility. Semen analysis shows the azoospermia, means decrease in the sperm count, and the biopsy image is given below. What is the most probable diagnosis? Okay, so here in the diagram you can see these are the round cells which are seen in the testis. Okay, and these cells are usually called the Sertoli cell tumors, and which is seen in the infertile patients, and in the urinary winning urinary maturation of the urethra you can see this type of cells, Sertoli cell like tumor. Okay, In testicular atrophy, you can't see this type of subtle type of cell. In non-seminomatous germ cell tumor, you can't see that cells. In orchitis, you can't also see these cells. So the answer here will be Sertoli cell only tumor. Okay. So here is the question. You can see the patient is present with a numbness in the thigh with impotence. An image show gangrene of the foot is given below. Which artery is involved? Okay, so here you can see there is a ischemic gangrene of the foot is seen due to any arterial obstruction. Okay, now in the diagram you can see, so this is the popliteal artery here, and this is a superior femoral artery. Okay, and this is a deep femoral artery, and this is iliac vein, and above that there is a aorta. Okay, so this kind of obstruction is usually seen in the above the iliac artery. Okay, so above the iliac artery obstruction is usually seen. In this option we have to identify what can be the answer. So there are option are internal iliac artery obstruction, bilateral popliteal artery obstruction, femoral artery obstruction, or aortoiliac bifurcation. So here the answer will be either internal iliac artery or aortoiliac bifurcation. But this kind of gangrene is usually seen while there is a obstruction above the iliac artery. So the answer will be the aortoiliac bifurcation. Okay, understood? And the next question. Following surgery for the varicose veins, patient started complaining of numbness along the medial aspect of the leg, which now is most commonly affected. Okay, so here you can see there are 4 nerves are given: superficial peroneal, deep peroneal, saphenous nerve, and the sural nerve. So usually the superficial peroneal nerve is going the medial side of the calf. Okay, medial side of the calf, and the deep peroneal is going to the deep to the flexure muscles, and so these two now will not come as the answer, because there is a numbness along the medial aspect of the leg, not the while the superficial peroneal nerve is going first medial aspect and going posterior aspect. Okay, now the saphenous nerve is going along the way of saphenous vein through the medial epicondyle of the tibia and the medial and goes down to the foot. So it going through the medial aspect of the leg, and the sural nerve is going posterior through the leg. So the answer here will be saphenous nerve, because it's going to the medial aspect of the leg. Okay, so the next question. A 45-year-old female underwent thyroidectomy. On the 3rd day she developed perioral numbness. Further investigation involved. Okay, so here the patient has undergone the thyroidectomy. This all we have already discussed in the ENT session. So here there will be no thyroid is present, so T3 T4 that can't be identified, and only gland left here is a parathyroid gland, which we can identify by the PTH levels. So here only option you can see the PTH levels is the calcium phosphate and PTH, and also she developed the perioral numbness which seen in the hypocalcemic tetany and the hypoparathyroidism. So the answer here will be B. Okay, next question. All of the following are the components of the MEN2B except. Okay, so here the parathyroid edema is the component of the MEN2A or MEN1. So, and other all are megacolon, marfanoid avitus, mucosal neuroma. They all are part of MEN2B. So the answer here will be parathyroid adenoma. Okay, so here you can see MEN2B characterized by medullary carcinoma, pheochromocytoma, mucosal neuromas, megacolon, marfanoid feature, interstitial ganglioneurus. Okay, so the next question. Most common site of intraperitoneal abscess. Okay, so here you can see in the lying down position, in the standing position. In the lying down position, most common site of intraperitoneal abscess is the recumbent position. In the recumbent position, and the rectocaval pouch, and the renal abscess. Okay, is the most common, while in the standing position then is intraperitoneal abscess is seen. So the here the answer will be the number number 4 is the answer. Okay, here you can see the hepatic flexure and the colon is the deepest space of the pore and the most common site of the subclinic abscess. Okay, a 35-year-old patient presented with the severe abdominal pain and vomiting. His vitals are stable. The radiograph is given below. What is the most effective way to treat this patient? Okay, so here you can see the elevation of the diaphragm. Okay, elevation of the diaphragm, which is seen in the acute appendicitis. And in this case, we are going to resuscitate patient and going to do a laparotomy for the appendicectomy. So the answer here will be D. An 11-month-old was brought to the emergency with pain, abdomen and multiple episodes of vomiting. Examination mass was palpable in the right lumbar region. Barium enema image is given below. What is the diagnosis? So here we also discuss in this radiology recalls that here you can see in the image the claw sign. Claw sign is usually seen in the intussusception. So the answer here will be intussusception. Patient with long-standing hemorrhoids came to the hospital for the routine checkup. On blood investigation, HB was 7 gram per deciliter. Peripheral blood smear. Following findings are seen. What is the most likely diagnosis? So this is the microcytic hypochromic red microcytic hemoglobin red blood cells you can see in the smear, and microscopic hypochromic hemoglobin usually seen in the iron deficiency anemia. Okay. So a delayed intravenous urogram of the patient is shown below. What is the most likely diagnosis? Okay, so here you can see the stagon calculi. Stagon calculi is seen like this. Okay, so this is not a stagon calculi. Then in the puticulum you can see the round appearance of the kidney, and then in the renal cyst you can see the cyst-like appearance. So here the no ureter is seen, no pelvic junction. So because of urine is not passing through it, and because of the obstruction in the pelvic ureteric junction. So the answer here is C. A 6-year-old child presented with the recurrent UTI, micturating cystourethrogram. Image of the patient is given below. What is the most likely diagnosis? Most likely diagnosis. So here you can see there is okay, you can see this diagram, the grade 1, grade 2, grade 3, grade 4 and grade 5. So vesicular reflex, you can see first there is no dilatation, then the non-dilated ureter is seen, then the mildly dilated in the grade 3, and the moderate dilated in grade 4, and the severe dilated in grade 5. So here you can see the severely dilated ureter is seen with the bladder, and it is the vesicular uretery reflex. Identify the correct diagnosis on the basis on given image of the newborn baby. So we already discussed in the PDR recalls that this is the bladder part and it is the extrophy of the bladder. Following surgery for the varicose vein, patient started complaining of the numbness along with the medial aspect of the leg. Okay, this is also being discussed. Then 25-year-old patient with history of massive artery developed dyspnea, petechial 3 days of coma, most likely cause. So in the RT, a patient with the petechial rest and the dyspnea after 3 days, so it will be the PET embolism, because in the thrombolism there might be hemorrhage in the spontaneous hemorrhage in the air embolism also, and the massive hemorrhage also spontaneous hemorrhage occurs. So after 3 days only the PET embolism is present there. Okay. A 30-year-old patient presented with casualty after motor vehicle accident. He has bruises on the chest. His pulse is 120 beats per minute and BP is 90 by 60 mmHg. The respiratory rate is 40 per minute. Chest X-ray was performed and shown below. What is the next most appropriate step in the management in this patient? Okay, so here you can see the pneumothorax, and the pneumothorax we are doing the chest drain injection in the drainage in the second intercostal space. A 9-year-old child brought to the hospital after burns. There was involvement of the half of the chest wall, abdomen towards the left side, and the posterior arm and the thigh. Figure the burn surface. This is half of the chest surface involved. Okay, and the half of the abdomen is involved, right? So here you can see the abdomen and thorax. Okay, so 6 by half and 2 by half means 9, and 2 of hand, so and also 9 4 percentage of the leg, so 9 and 2 11, and 11 and 4 15. So answer will be 15 by 20 percentage. Okay, with diagram you can easily solve the question. So 73-year-old man is bedridden for 15 years, and the image of the bed sore is given below. What is the grade of bed sore? Here you can, in the bed sore you can see there is a presence of the bone. Okay, this is the presence of the bone, and bone is present in the grade 4 category, right? In the grade 1 you can see the erythema of skin, and the epidermis is involved. In the stage 2 there is partial thickness skin in the epidermis, and the part of dermis is involved, and the whole dermis is involved in grade 3, and in grade 4 there is a bone is also involved. So here the answer will be grade 4. Okay, next question. A patient with history of chronic alcoholism presented to the OPD with whitish patch whose image is given below. What is the most probable diagnosis? Okay, we also discussed this in the ENT part of our recall, that the whitish patch is usually seen as a leukoplakia. In the submucous fibrosis there is a fibrosis present. The erythroplakia there is reddish patches seen, and the malakoplakia there is yellowish green patch is seen. Okay, this is in the diagram you can see the leukoplakia and the erythroplakia. Leukoplakia, erythroplakia, and the speckled erythroplakia. 45-year-old patient complains of the recurrent swelling in the one side of the neck. She is afraid of eating food as it worsens and the swelling. Imaging is performed and shown below. What is the most likely diagnosis? This also we have solved in the ENT portion, that this is the diagram of the sclerolithiasis, which is caused by the obstruction of the submandibular condylar duct. A patient came with the swelling near the angle of mandible. The swelling was non-tender and was firm. What is your diagnosis? This part we also discuss in the ENT portion, that this is swelling is non-tender and was firm. So all other are tender and firm. So the answer will be parotid tumor. Patient came to the OPD with erythematous neck, swelling in the supraclavicular region, and the pulsation were present over the swelling. Then the image is given below. What is the next step? So this also we discuss in the radiology and the ENT recall of my channel. You can see there. So in that you can identify there is a pulsatile pulsation which is present. So which is seen. The next line of step is the USC Doppler of the neck. Which of the following is the most likely to be seen due to rupture of the saccular aneurysm in the brain? So these also we discuss in the radiology portion, that subarachnoid hemorrhage is caused by the rupture of the subsaccular aneurysm in the brain. Okay. 45-year-old female presented with the galactorrhea. Her urine pregnancy test was negative. MRI brain revealed a large pituitary tumor, and the patient refused to undergo surgery for the tumor. Which of the following is best drug for the treatment of the patient? This also we discuss in the other question, but due to in the pharmacology, that in the galactorrhea patient, so there will be prolactinoma. Prolactinoma is present in the prolactinoma patient, and with the large pituitary tumor is also present. So the GnRH analog we should give, that is the bromocriptine. Okay. A patient with a step injury was brought to the emergency. Vitals were stable. Image is given below. What is the next best step of the management? So next best step we are going to do the further investigation, that it has injured the internal organs like intestine, liver, spleen, kidneys, or any other peritoneal. Okay, so we are going to do the further investigation. a patient with a staph injury. Okay, this one. Okay, so this is the end of our recall session of surgery, and I hope you like or and you will get more knowledge from this session. So like, share to your friends in your WhatsApp groups, and do comment in the session that what you need in this session that will improve your knowledge. And thanks for watching, and stay updated. Subscribe my channel for the further recalls.